Could you talk about cancer vaccines and how that can be a game changer?
So at the moment, if you were to get cancer, you're going to get chemo, radiotherapy, surgery, maybe some targeted therapies. Maybe if you're lucky, you might get immunotherapy if your cancer responds to that. Everyone gets the same type. A cancer vaccine takes this to a whole new angle now. The premise is a very simple one. You give someone a vaccine that will activate your immune system, and your immune system will either control, reduce, maybe even eliminate the cancer one day. So that's what we're trying to do. And then how does it work? Well, if you think about cancer, it's actually quite complex because it's got so many changes inside, which makes it abnormal. With cancer, we need to work out which of those abnormalities can you target. The space age thing, Shreya, is that actually it's personalised now. So the generation of research that's happening through now is that you make a cancer vaccine for that patient, for that immune system, for that cancer. That's what makes it space age. That's what's going to be tested over the next few years, and that's what's making it so exciting.
Welcome to the 51%, the podcast where we cut through the noise and get back to basics when it comes to women's health. Through expert insights and powerful personal stories, we help you tune in to what really matters. Your body, your well-being, your life. No one-size-fits-all advice, just real conversations to help you understand your health on your own terms. But before we dive in, I have a quick favour to ask. Please hit subscribe and join the 51% community on our website. It's free and it helps us grow, reach more women and create events that really speak to the health and wealth challenges we all face. And finally, just so you know, everything shared on this podcast is for information only. It's not medical or financial advice, and always speak to a qualified expert for support. Lennard, thank you for being on my podcast. It is absolutely fantastic to have you on. And I am really, really excited and curious to have this conversation because I've been following you for a while and I've been following your work, and I think it's so intriguing what you're doing. Could you please introduce yourself and talk a little bit about the work that you're doing, your background? That would be great. Thank you so much.
Shreya, thank you for having me on this show. I really appreciate it. I think I'm the first male guest too, so that's a huge privilege for me.
Absolutely, and more are welcome.
Thank you. Well, first I was going to say, well, thank you for inviting me on this show because the 51% actually matter. Actually, we can do much, much more to think about women's health and how we approach it and do it in the most thoughtful and kind manner. I think that's largely missing.
Yes.
And so who am I? I'm Dr Lennard Lee. I'm a medical oncologist. So I'm a cancer doctor trained in the NHS, and my job is to give hope to people with a cancer diagnosis. And I treat people. However, I'm also a cancer researcher too. So I work in Oxford University as an associate professor. And my work is around the great potential of cancer vaccines and how we can really start to accelerate this using AI. It's wonderful to be invited on this show.
No, thank you so much for coming. And that is exactly what caught my eye when I don't know whether I read or saw, but you were talking about cancer vaccines and AI, and that really intrigued me. And I thought, what is this about? Because I'd never heard of it. I'm on social media a lot. I'm Googling lots of stuff quite a lot, but I've never come across it, which is why I wanted to talk to you. Just to kind of talk about cancer from the basic understanding of it. I know, and a lot of people know, that cancer is on the rise generally. And for me personally, it feels like, why is it on the rise when there's so much research going on out there? And I know, I hear people saying, well, it's because we have an aging population and the diagnostics are much better. But is there something else going on? Because that kind of feels, we're at 1 in 2. And correct me if I'm wrong, you may or may not know, we're approaching everyone now.
Yeah, it's what I've chosen as my profession. I want to help people facing this and also the families supporting them. And specifically to women, this is 200,000 cases in the UK every year. That's 1 every 3 minutes. And actually, the problem that we need to solve here is that actually for women, you've got slightly different issues here because there are different types of cancers compared to men. So you've got breast cancer, endometrial cancer, ovarian and cervical cancer. And actually, you're right, 1 in 2 of us are going to be affected. But if I turn on the other side of the other side of the coin is that actually the most interesting thing for me is that 1 in 2 of us don't get cancer. And that's interesting because you get older and therefore you're going to have mistakes in your cell. Something goes wrong in the body and the growth will happen. But there is still 1 in 2 of us who are, I don't know if we was the right one, immune from cancer.
Yeah.
And the opportunity now is to crack that problem because this should be a solvable problem in this age of AI. And actually, in 2020, this country, the UK, showed that we can bring through vaccines quicker than ever before. So there's great promise here. And that's what actually makes me quite excited to be a researcher this time in 2026 because the potential is so great.
I never thought about it like that. And that is quite interesting. You know, we always say, 1 in 2, 1 in 2. You always think about the number 2 and not the number 1, if I can put it that way, because yes, there is one person still that probably won't get it. So what about that one person, I guess? And I never thought about it like that. But could you talk about cancer vaccines and how that can be a game changer? Because I know that's something you're working on, and we've all heard of what vaccines are. And when I heard about cancer vaccine, I thought, how can that be? How can that even work? There's so many different types of cancers you can get in your body. Like for me, a vaccine like COVID vaccine, as an example, that's just a vaccine to protect against one thing, which is COVID. Cancer, there's so many. So yeah, could you talk a bit about that?
So cancer vaccine is an area of research that the UK is really, really good at. We're actually world leading in terms of this. And no one talks about the potential of this technology, but it does exist. So what's the basic premise? Well, maybe I should start with what the status quo is. So at the moment, if you were to get cancer, you're going to get chemo, radiotherapy, surgery, maybe some targeted therapies. Maybe if you're lucky, you might get immunotherapy if your cancer responds to that. But they're all everyone gets the same type. A cancer vaccine takes this to a whole new angle now. I mean, and what's the premise? The premise is a very simple one. You give someone a vaccine that will activate your immune system, and your immune system will either control, reduce, maybe even eliminate the cancer one day. So that's what we're trying to do. Something that's just maybe a bit kinder, maybe using the latest technology. That's a potential here. And then how does it work? Well, if you think about cancer, it's actually quite complex because it's got so many changes inside, which makes it abnormal. What makes it suck all your food and grow quite quickly and spread. So each cancer's got about 10,000 abnormalities in it. So this is a slightly different problem than the pandemic, because the pandemic, we knew exactly what we were going against. It was SARS-CoV-2. With cancer, we need to work out which of those abnormalities can you target. The space age thing is that actually it's personalised now. So the generation of research that's happening through now is that you make a cancer vaccine for that patient, for that immune system, for that cancer. That's what makes it space age. So I guess if I was to recap, it is a new form of drug which is based on your standard mRNA vaccines, but it's personalised for you. And actually it's going to try and activate your immune system to control the cancer yourself. And that's new. That's what's going to be tested over the next few years. And that's what's making it so exciting, because this could be really move us forward in terms of cancer research.
So does that mean if someone were to get some form of cancer, and it could be any form of cancer, because there are hundreds of different types of cancers, does that mean whatever cancer that you get, you are able to identify that and create a specific kind of vaccine that is personalised to that person, which will then avoid them potentially having chemotherapy, radiotherapy, and a whole host of drugs that are probably involved as well?
It's incredible, isn't it?
Yeah, I mean, that sounds quite sci-fi in maybe 100 years' time or something, but yeah.
I think it'll be sooner than we think, actually, because our country is very, very good scientifically. We've got AI supercomputers. We've got so many scientists working on this in the UK cancer vaccine AI science and supercomputing project. And actually, yes, that's exactly the future we want to get to. I'm probably going to caveat it because as a doctor, I know that we're pretty cautious as a profession. So it's possible what we might do is put the vaccine with other drugs initially and then see what you can take away. But this whole new field is coming alive, which is fantastic. because people want to try and direct your immune system at cancer because we know that half the people never get cancer in their lives. So clearly their immune systems will be able to take care of it. How about the other half now? Can we offer just a bit more hope?
Yeah. So do you think with the half that don't get cancer, are those the types of people that you can look at to see, why are they not getting cancer in comparison to the people that are? Or, I mean, I guess that's quite hard because cancer can happen at any stage in your life, right?
Yeah. The people who don't get cancer, I've got to be more like them myself.
Yeah.
Eating fruit and veg, not smoking, not drinking, doing exercise, watching your weight. They're doing all the good stuff. And I like to think I'm doing some of those things too, but I can do more. I know that.
More? Gosh, I've seen your profile. How can you possibly do more, Brennan?
And I think that's really interesting. But if you keep those healthy living things, those 5 things, what you're effectively doing is you're boosting your immune system, keeping your immune system healthy and strong.
Yeah.
I mean, I think not everyone can be that noble and that healthy.
Yeah.
So cancer will always happen.
Yeah.
The question is, if it does, what's the next generation drugs going to look like? What's it going to look in 2030? Is it still going to be quite as tough as it is now? I hope not. And if you look at what's happened before, cancer research gets better every single year. Survival goes up. So I think this will become safer and there'll be a key part to play for cancer vaccines.
Do you think the, environmental factors and toxins and, of course, ultra-processed foods are rife now that, I think 90% of the supermarket is potentially full of ultra-processed foods. And then you've got the likes of, the fast food chains and everywhere you turn pretty much now. Do you think that's contributing to the fact that we're at 1 in 2 at the moment?
Yeah, I think there's increasing evidence here that diet does play a role in this, actually. Highly processed food, red meat are definitely things that people maybe might want to consider about pulling back on that.
Yeah.
I mean, the difficult thing is that life is for living. So you can't just stop all these things, and everything moderation. And the thing I will probably say on this space is that for anyone who's out there facing a cancer diagnosis or knows someone who's been affected, I would say as a cancer doctor, the one thing that you shouldn't do is look back and blame yourself, because actually what's been has been. You can't control that bit now too. And so maybe look into the future. In the 10 years, we'll have better drugs, better ways of preventing it. And maybe we'll know a bit more, but I don't think all the evidence is there. So I don't think you can't go to the supermarket and say, there's a label which says, there's your cancer risk on that one. It just doesn't exist. So we're kind of just making our way as best we can at the moment.
Absolutely.
But I do think you're right. We need to move a bit more into prevention, picking it up much sooner, and also making sure that the drugs that we have are safer. So if you do unfortunately get it or know a family member that get it, the next drugs be safer, more effective and much more precise.
So you mentioned AI. How does that fit into cancer vaccines? Because they feel like completely 2 separate things. How can you explain how you would combine the 2 to make this amazing vaccine for everyone?
Shreya, this is a really good question, actually. I'm glad you brought this in the podcast because it's going to make people think.
Yeah.
I'll probably say that in the last year, how everyone's thinking, communicating, understanding the world has been completely revolutionized by the likes of ChatGPT, Claude, Gemini. It's completely changed everything, how people think. And I was a skeptic. If you brought me here 1 year ago, I would say, no, we know exactly how to do cancer research. We've been doing it for 25 years. We don't need AI.
Yeah.
However, this was a problem that I needed to solve.
Yeah.
I told you about a 10,000 problem and you got to pick 20 to go into your cancer vaccine. So to play it back, cancer's got 10,000 abnormalities. You've got to pick 20 to put into the vaccine to stimulate the immune response. So I thought about this. And I thought, hang a minute, we can use the old tools, but I know a company which solved this using AI. That's Amazon. Because they have like 20,000 products at least. They've probably got hundreds of thousands products, but they always know what I want to buy and they put them at the top. So I said, okay, they've got an algorithm that's just working this space. So I brought in really talented PhD students, asked them, okay, now please solve the problem for me. If Amazon can do it, can you look at the 10,000 mutation and tell me what should go into cancer vaccines? He said, well, Leonard, you're going to have to get me a better laptop. I was like, okay, fine. We get you a better laptop to solve this problem.
Sounds like you need a whole data center to yourself or something.
Well, I thought, the AI tools are all out there. They're all on the internet.
Yeah.
So I asked my student, Michael, fantastic student, how long will it take you? He told me 6 months. I said, okay, we can get you through a PhD, but that's not very fast. What do you need to go faster? Well, he said, I need supercomputers, Leonard. I said, okay, well, let's go work out to find this.
Yeah.
He said, specifically AI supercomputers, which is different. It's a whole new type of computer which didn't exist.
Okay.
So I said, well, okay, I'll get you the Oxford University computers. He said he can get it down to 3 months. And that's still not fast enough. You need to go fast in the cancer research field to solve this problem. We can't have patients waiting 3 months to find the answer. So thankfully, this great nation's great, but one of the things it's done most fantastically is that we have started to have ambitions to keep up in this AI supercomputer race. And the Department for Science, Innovation, Technology has just launched 2 supercomputers in the UK.
Okay.
Well, so I thought, well, Michael, just apply.
Yeah.
And we got access. And now he's created a model which can give predictions in 2 days. So I know, from 6 months to 3 months to training models within 2 days to make these predictions. And so now the game is basically put as much data in that you can learn from, and then you can make a prediction which is going to be world class. So AI, just like you can ask AI questions now and it gives you answers instantaneously, it can do exactly the same for cancer research too. We can put in a cancer sequencing file and it will spit out a result and prediction about what a better cancer vaccine will be for that patient and that immune response.
Wow.
We've never had that tool before, and it just exists because of what we built in our sovereign AI supercomputer. I'm very proud of what happened there because it does mean that we continue to be world leading in this space.
Yeah. I guess we often think, the UK is quite behind when it comes to science and tech and things like that. And, I guess America are way ahead than what we are, which is great, to speak to you about this because people don't know about this. And I certainly did not know until I came across your profile, which was what intrigued me in the first place. You talk about it like producing all this information instantly. What information are you putting in there? Is it about a person's profile? Someone that's already got that cancer diagnosis that you're kind of putting in there to create the data, I guess.
Yeah. So what's happened over the last 20 to 30 years is that people have gone before us, want to give back so that people who are going to face a cancer diagnosis in decades ahead would be able to learn from their experiences. So actually, we've had maybe 2-3 decades of people being given their genetic data, and we thought that we got all the information out of it. We thought that actually, there's a paper, we describe what cancer looked like, and then we can stop there. And that was where we got to. But actually, the AI space has completely changed this completely because now we can go back and ask an AI to learn from these models. And it is learning so much faster than humans can do it, much, much quicker, seeing patterns that I cannot see, but it's making good predictions. And that's what's really amazing that's from the work that's happened in this supercomputer project, because it is able to see insights that we can't see. And going back to your first point, why is this important? Well, I think we are in this world where people are trying to understand what's the purpose in AI, and they're thinking, well, it makes fantastic memes for social media. It can turn me into a cartoon character, and it can change my voice, and it can make me say anything. And that's where we need to be at. I don't think that's why we're going in the UK. What I'm really proud of and being part of that AI for science strategy for the country is that we are going to use AI for a much nobler cause. It's not just to make funny pictures. It's to help cancer research. And we think that's really important. Actually, there's scientists all around our country now, all the universities and institutions and great organizations, which ask the question now, can we use AI to make drugs? Can we make tests? Can we improve women's health? I think these are the big questions that AI should be used for. Any technology can be used for good and for bad. I know in this country we're doing it for the very best reasons. And that's different than what's happening across the pond or in other parts of the world.
Absolutely. I think it could actually be a game changer for other things, as you've mentioned, especially women, women's bodies are, there's a huge lack of research in women's bodies. And if this could speed up the process like lightning speed,
Yes.
that would be fantastic, because we're so behind. And I always say, look, we can't wait for the research to catch up. God knows how long that's going to take. We've been researching for years and years and years, and we're still, nowhere there. So let's start looking at the basics of good health and focusing on what we can do as an individual to improve our health, and go from there onwards. But if you're going to create stuff, and lots of other scientists are going to create stuff that's going to kind of be at your fingertips, that's fantastic.
Yeah, sure. I think we're at an inflection point for science now, because let's take a problem that everyone knows. Let's say ovarian cancer.
Yeah.
That's a hard one to pick up, actually,
Yeah.
because it's just a bit of stomach pain, bit of discomfort. Everyone has that. Even I have that when you eat something not quite right. And often that's diagnosed late. And maybe the same with endometrial cancer.
Yeah.
Many of the symptoms are so subtle, you don't pick up on them. And they're often diagnosed late. Well, actually, there's this amazing product which I'm seeing come through now, which will completely change how we think about scientists and also research. It's called AI Scientists. Have you ever heard of that?
No.
Okay, so this is what's really interesting about it. These are now systems, I guess you might think of it like a ChatGPT or Gemini, but what it's able to do is it's able to think through the problem, generate hypotheses, plan experiments, and analyze results. So it's almost like a scientist in itself.
Yeah.
And one of our funders, the Advanced Research and Invention Agency, has been starting to pivot teams around the country to say, okay, a scientist can think this much. What happens if we now augment a scientist with an AI agent? How much faster can they achieve? So if I were to put this in one of our AI scientist program, it would say, well, the steps required to try and solve this problem of late stage diagnosis are A, B, C, D. I suggest you pick B or C. You might design experiments like this to test it. If you were to make a vaccine, these are the targets you go for, and I'll try and run this in lab for you. That's amazing, because all of a sudden you've taken, you've still got to put the human creativity there, and you've still got to put the governance in it, but all of a sudden it's coming up with things that you may not have thought about. So I put one of these questions in similar to that, and it gave me a 110-page plan of how I could go forward. And I still had to go back and check any of it.
Yeah.
Although I was like, okay, it's taken off the friction of research now. And scientists will change. How scientists think and do their research will speed up, just like we're seeing every sector speed up with AI. I think there's a real potential that cancer research will do. And maybe one day, late stage, we missed an ovarian cancer, or we didn't think about endometrial cancer may not be a thing, because actually we've really thought hard about it and pivoted great scientists with AI scientists together, working together to achieve that. It's a bit of science fiction for it.
Yeah. You talk about the AI and the vaccines. How are you ensuring that you're getting the right data, making sure you're capturing the data and the people from all, ethnic minorities, all races, all, different socioeconomic groups? How can you ensure that?
So important. Really good question, actually, because if you look at cancer diagnoses by country, it varies quite a bit, actually. Some cancers are very, very common in certain ethnic groups or backgrounds. So you need to put in that into your model. So what we start to do is make sure that we are representative. And my team is really, really interested in this. The scientific terminology is called HLA. That's what your immune system can recognize. So what we start to do is we bake that into our model. We need to know what the person's HLA type is before we make a prediction. So that means that we're not just predicting for Caucasian groups.
Yeah.
We can also say, well, we predict that actually if you're of Indian background or Chinese background or Middle Eastern background, our predictions will still work. And that's really important. So that's going into the AI model, and we're training the AI to try and learn for all these patterns too. And then we'll think that's going to make it even better than what it already is.
Yeah, that's fantastic. I think that's so important, because there's already, lack of data on people from different backgrounds as well, and getting that in there, that's going to be That's going to be great. So, because I'm sure, there's people that have got cancer diagnosis now, and potentially, if we're at 1 in 2, 50% of the population will get it. When can we expect this to come through?
Yeah. So the drugs that we've got in the NHS are really good at the moment. So I think if you get offered something, talk about the pros and cons, and I think they're going to be really good. I mean, we have best in class drugs.
Yeah.
But looking to the future now, what does the next 5 to 10 years look like? Well, for cancer vaccines, for any cancer trial, you've got 3 phases of research to prove it before it can be used across the whole of the healthcare system.
Yeah.
So what we do know is the first cancer vaccine, which is the mRNA one, has completed phase 3 trials at the moment.
Okay.
No, it's for skin cancer.
Okay.
It's within 5 years of the pandemic, from mRNA technology being conceived in 2020 to the first drug which was used outside the trial from the UK. We were the first. We must always remember that we were first to give a pandemic vaccine outside drug. Within 5 years, we should hopefully get the results of the first cancer vaccine trial. That'll probably be, it's going to be for a rare type of skin cancer. We don't know if it's going to be positive yet, although I hope it will be, because that will start to accelerate everything else beyond that. And then I look behind that and I can see, well, actually, there's a lot more trials which are about to read out shortly. So I think 26 and 27 is going to be really interesting from these big results. Yeah, these will start to read out, and that will be a really exciting time.
What could potentially stop this from coming out and reaching everyone? Because there are, sometimes there are barriers for vaccines or certain drugs to be available to everyone as well. And is that a possibility?
So what are the barriers? Well, I guess the first barrier might be, I don't really want, it is that the vaccine hesitancies that started to come about. And I kind of understand that, because in some countries, they force vaccines on people without them having any choice. They were just telling them there was a mandate, you do not have a choice on this one. I think where we're really good in the UK is that we did it with the public support. So I was on independent stage, and we were basically saying it's your choice, the pros and the cons. You'll likely to get your freedom back and protect your family members, and maybe you'll be protected too, but there'll be rare side effects. So in the UK, we're really good, and I think that was across all of Europe too.
Yeah.
But you look at what's happening in America at the moment, the fear of vaccines. I think that's going to be an issue, actually, because I think this is a personal choice issue.
Yeah.
If you have a cancer diagnosis and the surgeon managed to get it out, but you're really worried every single year afterwards that it might come back, can you help stimulate your immune response? I would say that's their choice. Their choice to take a vaccine at that stage, and maybe hopefully the cancer doesn't come back, or even reduce the likelihood.
Yeah.
But I guess what will happen, you have to monitor this quite carefully, because if America keeps going on this unusual stance of we're a no vaccine country or we don't believe in vaccines, then actually it may stop one of the greatest moments in humanity where we've given vaccines to give freedom to the world.
Yeah.
And that was UK and America. But then the Americans chose not to pursue cancer vaccines.
Yeah.
Even though it's cheap, easy to make, highly efficacious, using AI, could cause immunity for the world.
Yeah.
And then there'll have to be countries which come up and say, actually, no, we do believe in this because of all the benefits it's giving. So I think, politics, surprisingly, is going to play a part in research. And it's not so much an issue here, but it certainly is an issue in America.
Yeah. And I guess, trust is a big thing as well. I know even in the UK, there were some parts of the population that potentially didn't want to take the COVID vaccine because they didn't trust the vaccine. How are you going to build that trust for people to take up the vaccine? Because certain parts of the population probably won't want to take it.
I think it's a good question, actually. And that's what's so good about your listeners, because they will start to spread the word. And this podcast here is fantastic, because what we're doing early here is build the trust.
Yeah.
I'm basically saying that we can use AI and it's looking quite good.
Yeah.
We're also balancing the risks and monitoring that too, to see if it's causing a good immune response. And actually, I think what was really good was actually we communicate outwards about our research program and develop that trust over time. I think America will move in this space once they see the benefits of it. And actually, this is not something that's going to be forced on anyone, really.
Yeah.
All we're trying to do here is help you become one of those 50% where their body can see what an abnormal cancer cell looks like and maybe control it.
Yeah.
So I don't think there's harm. And actually, the most important things that scientists can do is talk about what's happening in the field and actually talk to great podcasters like yourself and able to see the benefits, because all technology has good things and bad things. And however, I do believe that vaccines can be used to try and develop immunity from cancer. And this could help many of the cancer types at the moment where people run out of drug options.
So I just want to clarify, you say immunity. Is this something you can take before you even get cancer, or is it something or after, or both?
So preventative vaccines, this is a great thing.
Yeah.
Well, I think the first thing I'll say is preventative vaccines already exist. So you know how girls at the moment are being offered the HPV vaccine?
Yeah.
That is something they must get. And if you're a parent out there, make sure they do take that, because that will basically eradicate many cervical cancer.
Yeah.
Many parts of the country no longer will see that cancer. And if the vaccination rates remain high, that may be gone completely in terms of ailments that humans would suffer. Like polio has almost been got rid of. Then cervical cancer could go with that. The other one is we used to get, and you can still get your hepatitis B vaccine. That would usually reduce your liver cancer. What we think of this technology is that as you see successes coming through in 26 and 27, people are going to start to pivot now and say, actually, well, what does preventative vaccines look like? And moving into that space. I don't know if we will get to that stage and when we'll get to the stage where maybe at 50, you'll get a vaccine for 10 types of cancer. I hope that would happen, but we've got to take all the steps along the way. Prove that AI is speeding us up, showing the vaccine works in trials, and then move it earlier and earlier, because that will be where we would hopefully get to one day.
Yeah, and I guess it would be for more of the kind of common cancers, as opposed to, because there's so many different types of cancers, you can get things that I've never even heard of. So what happens to the ones that are kind of not as well known?
I think what was interesting about a personalised approach to drug treatment is that as long as you can see mutation, you can make a prediction. We call ours the Cancer Vaccine GPT, make a prediction what a vaccine should look like. So I'd hope at that stage, when you've got a platform technology which goes from, I see a mutation, I know your immune type, to this is what cancer vaccine should look like, it may not matter if that cancer was rare or not. You may still be able to give a drug in that case. And that's why I think is potentially exciting about personalised drugs. You don't need to, let's say you've got a rare cancer type which only occurs, 100 times a year in the UK. It's really hard to prove a drug in that situation. But with a personalised approach, well, actually, and you see immune responses, I think it does become a bit easy in terms of making this more widely available. So there's definitely hope. I feel positive in this space.
Yeah. When this comes out, are we gonna be at a stage where I don't have cancer, but I can get vaccinated to prevent getting the most common cancers, for me as a woman, whether that's breast cancer, ovarian cancer, and perhaps some other cancers, and I have got cancer, and I can be given a vaccine to cure that?
So I definitely think you're right. I think cancer vaccines are about to land because we can now activate immune response to target whatever we know is abnormal, which is causing cancer. So I think that's going to be really exciting for people who've had maybe a surgery where they're really worried for the next 10 years, what's that scan going to show? Is it going to come back? We might be able to activate a monitoring system which allows your immune system to pick that up. I'd also hope that maybe one day we can start to have more inroads into people where the cancer spread everywhere. It's called stage 4 cancer. Hopefully we can start to boost efficacy there too. If both those become true and work, then I completely see a scenario where actually the greatest minds, the greatest scientists all around the world start to focus on the big problem now, which is we need to activate vaccines which are truly preventative for the 1 in 2 of us who don't have as good immune response as the other 2. I think that's a bit further away, although I think it's possible now, actually, the speed of research is going. And actually, there's groups at the moment already starting to move into this space much, much earlier. And that's where the greatest benefit will come.
Yeah. That's fantastic. Lennard, thank you so much for your amazing insights. And I think you're doing amazing. I think what you're doing is just fantastic. That's my opinion. And thank you so much for being on the podcast. It's been great.
That's right. And thank you very much for having me here. And the thing I would say is actually there are so many great scientists working in this space now. And none of this is possible without any of our funders like the UKRI, Department of Science, Innovation, Trade, ARIA, Cancer Research UK, and the great universities at Oxford and Cambridge are pivoting here. All these people are making this happen. So this is a great potential for the future.
Thank you. I'm glad you highlighted all of that, actually, because it's not just the work of, one set of people. There's a lot of institutions and people involved in this, which is fantastic.
And we do this because of people who listen to this podcast, because we need to solve the problem of rare cancers, female cancers, inequalities. And actually, because we have listener support, this is what allows the scientists to lead. So thank you, Shreya.
Thank you.